Acethepharm safe and effective instructions for use. 1. Composition and uses. Composition. Acethepharm contains acetylcysteine as the active ingredient, a mucolytic agent that works to thin the mucus in the respiratory tract, making it easier to remove and reducing airway blockage. Uses. Acethepharm is indicated for use in cases of 1. Composition and uses acute and chronic respiratory infections, such as bronchitis, pneumonia, sinusitis, allergic rhinitis, otitis media. Airway obstruction due to mucus, helping to thin the mucus, making it easier to remove, and clearing the airway. 1. Composition and uses acute and chronic respiratory infections, such as bronchitis, pneumonia, sinusitis, allergic rhinitis, otitis media. Airway obstruction due to mucus, helping to thin the mucus, making it easier to remove, and clearing the airway. 1. Composition and uses acute and chronic respiratory infections, such as bronchitis, pneumonia, sinusitis, allergic rhinitis, otitis media. Airway obstruction due to mucus, helping to thin the mucus, making it easier to remove, and clearing the airway. 2. Dosage and administration. Adults and children over 6 years old 2 sachets time, 3 times day. Children 26 years old 2 sachets time, 2 times day. Administration. Dissolve the medication in warm water, stir well and drink after meals. 3. Contraindications. History of asthma. Acethepharm can increase the risk of bronchospasm in people with a history of asthma. Hypersensitivity to acetylcysteine or other ingredients of the medication. Do not use the medication if you are allergic to acetylcysteine or any other ingredient of the medication. 3. Contraindications. Children under 2 years old. Acethepharm is contraindicated for use in children under 2 years old. 4. Precautions. People with a history of asthma and allergies closely monitor patients, discontinue the medication and switch to bronchodilators salbutamol or ipratropium if there are signs of bronchospasm. People with decreased coughing ability combine with mucus suction to effectively remove mucus. 4. Precautions. Pregnant women using acethepharm to treat paracetamol overdose is safe and effective, with the potential to prevent liver toxicity in the fetus and mother. Breastfeeding women. Acethepharm has been proven safe for breastfeeding women. 5. Side effects. Common: nausea, vomiting, diarrhea, rash, itching. Nausea, vomiting, diarrhea. 5. Side effects. Rash, itching. Uncommon: bronchospasm, angioedema, anaphylactic shock, bronchospasm. 5. Side effects. Angioedema, anaphylactic shock. Rare: liver dysfunction, hepatitis, respiratory failure. 5. Side effects. Death in cases of overdose or severe allergic reaction, liver dysfunction, hepatitis, respiratory failure. Death in cases of overdose or severe allergic reaction, nausea, vomiting. 5. Side effects. Diarrhea, rash, itching, bronchospasm, angioedema, anaphylactic shock, liver dysfunction. 5. Side effects. Hepatitis, respiratory failure. Death in cases of overdose or severe allergic reaction. 6. Drug interactions. Acethepharm may interact with certain other medications, leading to reduced treatment efficacy or increased risk of side effects. 6. Drug interactions. Inform your doctor of all medications you are currently using, including prescription medications, over-the-counter medications, herbal medications, and dietary supplements. 7. Overdose. Overdose symptoms: nausea, vomiting, abdominal pain, diarrhea, dizziness, muscle weakness. Management: discontinue the medication, inform your doctor or go to the nearest healthcare facility for prompt treatment. Note: information about acethepharm is provided for informational purposes only, and does not replace the advice of a healthcare professional. Always consult with your doctor or pharmacist before using any medication. Always read the instructions carefully before taking medication. Note: store the medication in a dry, cool place, away from direct sunlight. Keep out of reach of children.